Good morning, ma'am. I'm Shine Enriquez, and I'm your nurse for today. May I know your name, ma'am?
Tendon,
Your birthday?
May 16, 1998.
Okay, so for today, ma'am, I'm going to assess your neurologic, musculoskeletal, and peripheral vascular system. Would that be okay, ma'am?
Yes.
Next, make sure to perform hand hygiene to prevent microorganisms from spreading.
When assessing the neurologic system, begin with the highest levels of neurologic system and work down to the lowest. First one being the mental status and speech, the cranial nerve function, sensory function, motor function, and the reflexes. To start the assessment, let's begin with evaluating the patient's orientation to person, place, and time. Can you say the date today, ma'am?
March 26, 2022.
And do you know what day of the week?
Saturday.
Okay. Do you know the place you're in right now?
Hospital.
And what country do you live in?
Philippines.
Okay. So next, I'll be testing your memory, ma'am. So this will be done in 3 parts, which are the immediate memory, remote memory, and the recent memory. So for the immediate memory or recall, I'm gonna say 3 words and you're gonna repeat it. So apple, yellow stars.
Apple, yellow stars.
Okay, so we tested already her immediate recall. Next, for the remote memory, can you tell me who's your best friend in elementary?
Chari.
Okay. For the recent memory, what did you eat for lunch today?
Fried fish.
Since I was able to have a proper conversation with my patient, I can say that my patient is alert.
For the next part, we are going to assess the patient's abstract thoughts. We're gonna do this by assessing the patient's ability to understand proverbs.
So, ma'am, can you elaborate the meaning of early bird catches worm?
Warmer. Kung kinsa man unang niabot, siya man may mas dakong tsansang maabot ang kalampusan.
Okay, very good.
Next, evaluate the patient's ability to understand spoken words along with her reading and writing ability. So I'm gonna have my patient read what's written in a piece of paper and ask her to do the action stated. This will test the patient's ability to read and comprehend.
So, can you read and do what is stated in this piece of paper, ma'am?
Close your right eye.
Very good.
Next is test for cranial nerve functions. First is ask the patient to close the eyes and occlude one nostril and make her identify the smell of it.
Strawberry color.
Next, we're going to test the visual acuity using the Snellen's chart and also perform the confrontational visual field test. Next, we're going to move the patient's eyes through the cardinal position of gaze. Next, we're going to test for the hearing.
Red.
After that, we're going to test the gag reflex by touching the posterior pharynx with a tongue depressor. Next, I'm going to place my hands on the patient's shoulders while she shrugs against the resistance. Next, inspect the ability of the patient to move her neck. Ask the patient to touch her chin to chest and to each shoulder each ear to the corresponding shoulder and then tip head back as far as possible. After that, ask the patient to extend arms forward and then rapidly turn palms up and down. After that, we're going to inspect and palpate the hands, fingers, wrist, and elbow joints. And then, we're going to palpate the radial and brachial pulses. And then, have the patient squeeze 2 of your fingers. Next, ask the patient to close her eyes and place a familiar object in the patient's hand and ask her to identify it. After that, ask the patient to close her eyes and using your finger, trace one-digit number on the patient's palm and ask her to identify the number. Next, assist the patient to supine position and examine the lower extremities. Inspect the legs and feet for color, lesions, varicosities, hair growth, nail growth, edema, and muscle mass. Test for pitting edema in the peritibial area by pressing fingers into the skin of it. If an indentation remains in the skin after the fingers have been lifted, pitting edema is present. Next, we're going to palpate for pulse and skin temperature at the posterior tibial, dorsalis pedis, and popliteal areas. Next, have the patient perform the straight leg test with one leg at a time. Next, ask the patient to move one leg laterally with the knee straight to test abduction and medially to test adduction of the hips. After that, ask the patient to raise the thigh against the resistance of your hands. Next, have the patient push outward against the resistance of your hands. Then have the patient pull backward against the resistance of your hand. Repeat on the opposite side. Then ask the patient to dorsiflex and then plantar flex both feet against the opposing resistance. After that, stroke the sole of the patient's foot with the end of a reflex hammer handle. And then assist the patient to a standing position and observe the patient as he or she walks with a regular gait on the toes and the heels and then heel to toe. After that, perform the Romberg's test and ask the patient to stand straight with feet together with both eyes closed and arms at side. Wait for 20 seconds and observe for patient swaying and ability to maintain balance. So next, we're going to assess the patient's deep tendon reflex in the patient's wrist, antecubital area, and the triceps tendon area. So in this, we're going to use a reflex hammer. And also below in the patella. And lastly, the Achilles tendon area. So after that, we're going to assist our patient in a comfortable position, then perform hand hygiene, then document the findings.